So I have been invited to join this group today to share a little bit more about the Ontario Caregiver Organization. I'm going to speak a little bit about caregiving in Ontario and tell you a lot about our organization. So we will have time at the end for questions. So if folks have questions, put those into the chat, write them down, remember them, whatever method works best for you. And I'll also be sharing my information at the end as well. So if folks would rather connect with me outside of this presentation, you're more than welcome to send me a message and we can have a conversation as well. So a little bit about me, just for context, it might be helpful. So I come to this work as a former clinician. I worked in local communities with a range of individuals with a range of needs across lifespan, across diagnoses. Um, in my early stage of my career as a rehab therapist for folks with acquired brain injury, I also worked as a behavior therapist for adults and children with maladaptive or difficult behaviors. But I also come to this work as a caregiver. So I was a young caregiver living with grandparents who had stroke and dementia. I've also been a caregiver to an adult with a mental health and addictions challenge and his son with autism. So I feel really passionate about this work and supporting caregivers, and hopefully something that you hear about today really supports you in your caregiving role and leads you to get support, whether that be through the Brain Injury Association of York Region or others, or through our organization at the Ontario Caregiver Organization. So some of you might be asking, like, wait a second, I've never heard of this organization before. What's the deal? What's the story? And that's because we're relatively new. I'm getting close to the point where I need to maybe adapt that a little bit, but we were established in 2018. We came out of a lot of work done by the Change Foundation and also family caregivers. There was a report written to the Minister of Health outlining the importance of the role of caregivers, essentially saying in a nutshell, these folks are the backbone of our healthcare system, and we need to do better to support them, and made a number of recommendations. One of those recommendations was the formation of a nonprofit whose sole purpose and focus are caregivers. And here we are. So we are fully funded by the Ministry of Health. We are a nonprofit organization, which means all of what I'm going to share about the work we do today comes at no cost to the user. And really, our purpose is to improve the lives of Ontario's caregivers. And when we're talking about caregivers today, what I'm talking about, what I'm referring to are everyday people who provide support to someone else. It could be physical support, it could be emotional support, it could be a family member, it could be a friend, it could be a neighbor, it could be your spouse, it really could be anyone. So to give a bit of context about caregiving in Ontario, there are about 4 million caregivers. This number continues to grow, at least it has since we started in 2018. And it's not specific to an age group. I think sometimes people think of caregiving as being something only for older adults. But certainly there are folks as young as 8 years old caregiving and folks as old as 108 caregiving and everything in between. So we know that the majority of people right now fall between that 26 and 64 age range. It's also almost an even split between folks that identify as female and those that identify as male. We sometimes think about caregiving as being a female dominated sport, and it really isn't. We just access services and resources a little bit differently. And 64% are doing all of their caregiving and trying to balance employment or some sort of work at the same time. We know from this research that we've done, so the data I just shared and a little bit more, and don't worry, it's not all going to be statistics, but is all of this data comes from something called the Spotlight Report. And this is something we do every year, and we update it annually. And in the most recent Spotlight Report, what we know is that 32% of caregivers are spending 10 hours or more a week caring for somebody else. Almost 80% feel that they've taken on a role or a job that otherwise would have fallen to a personal support worker or a nurse. And 1 in 5 caregivers say that they're rarely or ever included in conversations and discussions about care. When we think about caregiver health and well-being, 25% are saying their tasks have become more difficult since the easing of the pandemic restrictions. 1 in 5 caregivers say their mental health is worse now than it was during the pandemic, and 63% of caregivers are saying, I'm done. I've hit my breaking point. I can't keep going like this. So when we ask caregivers, what do you need? What's going to help you in your role? The top 3 things that they say they need are respite, so a regular, structured, supportive break, mental health support, so clinical supports, helping them with any mental health challenges that they may experience, caregiving, and peer support, connection to each other. Caregiving can feel really isolating. And so talking to other people who've walked in their shoes can really alleviate some of that feeling of isolation. But 1 in 3 are facing barriers in accessing the support. So in some communities, there's really long wait times to get respite or mental health services that are affordable. In some communities, these services just aren't even available, or other services that they need just aren't available. And the other thing I think that's really important to think about is that 1 in 4 caregivers say, I don't know what I need. And when I have the privilege and benefit of talking to caregivers, a lot of times they say, Katie, I never identified with that term caregiving. That's just, it's my husband, or it's my mom, it's my kid. These are relationships and things that I just take on naturally. I don't think of myself as a caregiver. So sometimes that creates barriers to accessing supports and resources for the caregiver. And there's not always caregiving supports available for folks, as we just heard. And we don't know what we need. No one gives you a handbook. When you go in, if your loved one sustains a traumatic brain injury, we're focused on that person and getting them the rehab and the supports that they need in the hospital or in home or community. We're not handing folks a handbook necessarily and saying, this is what caregiving means now. And a large part of the reason for that is that every caregiving experience is so different. So hopefully that's where we can come in and provide some supports and resources to those 1 in 4 that are saying, I don't know what I need. This image that you hopefully can see on the screen, and if anyone has called in and can't see the screen, I'll describe it for you, sort of illustrates the core buckets or things that we do. So there's a bunch of circles on the screen, and each circle represents our different areas of work. So the caregiver and public information, for programs and services for caregivers, the system work that we do with hospitals, long-term care, and other healthcare system entities, our public awareness initiatives, and how we work with caregivers, collecting insights and engaging them in the work that we do. So I'm going to go through really quickly, but hopefully in a helpful way, the key things that we do in each of these categories. So the first category of caregiver insights and engagement, how we work with caregivers. I mentioned the Spotlight report. That's something that we put out every year, and you can find all of this on our website. We have a caregiver panel that I'm going to talk about a bit more in a second, where we invite caregivers to join us and provide insights and feedback on things like our programs and services. Researchers come to us asking questions and inviting caregivers to participate in research. We do often have working groups for specific work areas in our organization. We have an advisory group. We have the panel. Sometimes we co-design or co-develop our programs and resources, and we're always trying to build things or adapt things or create something where there's a need and from the perspective of the caregiver. So our Caregiver Voices is a platform that we utilize. It's online, so there's a lot of flexibility. Caregivers are very busy people, but some of you really enjoy giving your feedback or contributing in different ways at a time that works for you. And this is an online platform for caregivers to share their stories. It's available in English and French. All of our services are available in English and French. But as I said earlier, it's also a space where we might call out and say, hey, we're looking for caregivers to support this activity. Is anyone interested and available? Community partners are looking for feedback or insights on this project or this research. Is anyone interested? And so you can be really selective about how you participate and what kind of feedback you provide. So to the next little bubble of caregiver and public information, we have a lot of information. Sometimes it feels a little overwhelming. So of course we have websites. I think most organizations these days do. Our main website is ontariocaregiver.ca. And that's where you can find all of the information that I'm talking about today. We are in the process of updating the website because we know that it is full of great information and we want to make it as easy for caregivers and providers to find that information as quickly as possible. So it's going through a bit of a redesign right now, but it's still up and available and you can find all this information there. We also have a site just for young caregivers. So I talked about caregiving not being specific to older adults or adult populations. And so this website was made for young people by young people, and it's a space they can go to get information and chat with other young caregivers in a safe virtual space. We have e-bulletins and newsletters and all kinds of social media. So if you're a follower of that sort of work, I would encourage you to sign up for that. And when you go to our website, you'll find, like I say, a lot of information, but also a lot of toolkits and tip sheets and other resources that are really helpful for folks. It's all free, it's all downloadable, you can print it in English and in French. And we're working on making some of this available in other languages as well. We have a toolkit called I'm a Caregiver. It's sort of an introductory or a getting started toolkit. There's information about caregiving. There's a quiz to check in on your well-being. There's a tool to help you think about how can you delegate and invite people to help you in all of the care that you're providing. We have toolkits for folks that are working and helping them have conversations with their employers, think about things that they can maybe ask for and give them resources and tools on how to ask for those things and keep the conversation going. We have toolkits for contingency planning and emergency preparedness. So what happens to them if something happens to me, right? This is a question that can come up oftentimes and is a big source of stress for caregivers. And this helps you put pen to paper and thought to paper about how can we plan for some of these uncertainties. We have resources on health, privacy, and consent laws in Ontario. This is something that a lot of us struggle with as caregivers, where we might be supporting loved ones who have abilities and capacity legally to make their own decisions, but maybe, we want to be a part of those conversations, or maybe we feel like they're not making the best decisions all the time, and there's rules and laws in place to prevent us from interfering. And so it's really helpful to understand what those rules and laws are and how it affects you as a caregiver. So this is a great toolkit to check out. We have a healthcare journey binder, which is really useful to organize all of that documentation, paperwork, especially in the ABI community. There's a lot of paperwork. And sometimes it ends up in shoe boxes or piles or random places. And this is a binder that will really help you organize all of that and keep it all in one space. We have a 90-second caregiver subscription, which is another newsletter type of thing. It's all evidence-based information that comes to your inbox once a week, 90 seconds, quick read, inspiration, education, motivation to keep you going as a caregiver. And, why not also have a podcast? So we have a podcast as well. We're on season 3 now, which is great. They're really lovely. So if you're into podcasting, I know I am. You can find and subscribe to that anywhere you can find podcasts. Great range of subject matter experts and caregivers that come and share some education information and share their stories. Also, under that umbrella of information and education, we do presentations for caregivers as well, in person or virtual. So things like what we're doing today, talking a little bit more about our organization. We also do sort of an introduction to caregiving. We do a stress and burnout presentation, presentation around working in caregiving, contingency planning and emergency preparedness and communication tips. How do we communicate with healthcare teams, maybe people in our circle of care, and be most effective? So there's lots of education opportunities and information that's available to caregivers. Now we'll move to the next circle around direct to caregiver programs and services. Our helpline is something that's available in multiple languages. So I mentioned earlier that most of what we do comes in English and French, but we also have a helpline that's available to you 24 hours a day, 7 days a week. You'll call, you'll get a human on the other end of the phone. If English is not your first language, you can access over 200 languages through translation. And it's a point of access for caregivers to get information and referral to things in their own community. So a lot of times what we hear is, well, Katie, you're a provincial organization, your main office is in Toronto, but I live in Sudbury. Are you going to give me Toronto resources? No. I live in the Niagara region. We have staff all over Ontario, and the helpline really narrows down to what's available in your own community based on postal code. So you don't need to tell them your whole story. It's confidential. You don't even need to tell them your name if you don't want to. They'll just ask for your first 3 digits of your postal code. You ask the questions that you have, you share whatever information you want to share, and they'll do their best to find the information you're looking for in your own community. Now, this is not a crisis line, but should you call in distress or in crisis, they will do a warm transfer. So they'll stay on the phone with you and put you in touch with the appropriate distress center crisis line. Or in some cases, I've been on the floor where it's been an emergency and really they should have called 911. And those call takers stay on the phone and connect them to emergency services and make sure they're getting the support that they need at the time they need it. We also do webinars just like this. And so we cover a lot of different topics. Sometimes they're diagnosis specific. A lot of the times they're really general. We have CRA coming in a week, maybe even be tomorrow actually, joining us to talk about tax credits and benefits for caregivers. They join us a few times a year because finances and financial difficulties is usually a top need that caregivers have. We talk about well-being and mental health. We talk about financial and legal tips, advanced care planning, skill development. Also in November, we have Dr. Patrick McGrath joining us to talk about grief, which is a common feeling we have as caregivers, not only when we lose a loved one, but anticipatory grief and the grief and loss of who we are, our partners, different circumstances in our life. So all kinds of opportunities to get online education. They're live, but they're also recorded because let's be honest, we're not all available on Thursday at noon. And so it's nice to be able to sign up and get the recording sent to your email, and you can watch it anytime you want, or you can pop onto our YouTube channel right now and see all of the last several years of webinars that we've hosted, and it's all free and it's available free to watch as much or as little as you like. We have a mental health and well-being program. It's called SCALE. It's an acronym because, everything is an acronym these days. It stands for Supporting Caregiver Awareness, Learning, and Empowerment. But essentially, it's a mental health and well-being program for caregivers. So I know in my caregiving experience, I experienced a lot of stress. I experienced a lot of frustration, a lot of guilt and resentment, a lot of anger. And this program here supports that. So it provides you with tools and strategies to overcome some of these feelings that we feel that we don't always want to talk about. And we also offer free counseling sessions as part of this as well. So there's individual counseling and group counseling. Now, this is not forever counseling. We wish that it was. Unfortunately, we're not able to do that from a financial standpoint right now. But it is specific to the scale program. And so it helps you essentially take all these tools and ideas and strategies and implement them. Sometimes in our caregiving experience, we have barriers or we have challenges or things that prevent us from going, wow, that was really helpful and really great. And we close our laptop and then we move on with our day and we don't actually implement these things when it could really support us in our caregiving role. So this runs twice a year. It's running right now. You can sign up at any point in time during the weeks to get the information, and they're also recorded. So if you've missed a week, you can go back and watch it at any time that works for you. Sorry, there we go. We have e-learning. So it's just another way of getting information and learning on your own time. So these are free online modules, again, available whenever you want. You can start and stop, do 10 minutes at a time. You can sit down and plow through the whole thing if you want. So we have a Caregiver 101, which is an introduction to caregiving. Caregivers partnering with healthcare professionals, so strategy that works for you, and an e-learning module all around the realities of mental illness and addictions. Now, we heard in the beginning that folks are really struggling. One of the things that they want is that peer support, and that's something that we do offer at OCO as well. So we have online support groups. This started through the pandemic. We were already operating virtually, and so we wanted to add this to offset those in-person groups that folks weren't able to join. And then the people joining said, we want this to continue, keep this going. So we have these virtual groups. They run at different times of day. We just opened up an evening group if that's something of interest to folks. They are general population groups, so it's not specific to ABI. It's not specific to a diagnosis. It is open to anyone with a caregiving experience. We do have a group for young caregivers. We also have a group for Francophone caregivers as well. Those are our only specific groups. And it's done over Zoom. So just like this, you can access it in our little Brady Bunch boxes, or you can call in over the phone as well. We have a one-to-one peer support program where we connect a caregiver with a caregiver mentor. So if you're looking for support, you want to talk to somebody maybe with a little more specific experience. Maybe you want to talk to somebody who's gone through TBI, traumatic brain injury, through motor vehicle collision and all the challenges and frustrations that come with auto insurance and the legal side of things and all of that. Maybe that's something that you really want to chat with somebody about. Versus being in this general population of people that might not fully understand what that means. So you can sign up for our peer support program. It's all done over the phone. We do our best to match you with somebody as closely as we can, in whether it be based on diagnosis. Sometimes people like it based on relationship dynamic. So caring for a spouse is very different than caring for a child or an older adult in your life. The relationship dynamics are difficult sometimes. So whatever it looks like for you, and it's done at a time that works for you as well, all over the phone, whenever you and your mentor agree to connect, that's when you connect. We also have a caregiver coaching program. So this is available. It's time limited, so it's up to 6 one-to-one support sessions, and it's there for folks that are really struggling. We focus on problem solving and goal setting. We look at building resiliency, offer strategies, resources, information. It also offers a bit of accountability. So sometimes, like I say, we get these really great tips and strategies, but we don't always implement them. I was one of those caregivers. And so this really helps you know, okay, I'm going to talk to my coach again next week. I need to, do the thing that we talked about that I was going to do. And so the coaches that we have are caregivers or were former caregivers and also have additional expertise, whether that be social work backgrounds, system navigators, or other healthcare backgrounds that are really going to support the caregiver that's calling in looking for coaching. So that gives you a bit of a summary about our programs and services. I'm going to share now a little bit about our system outreach and collaboration. I'm not going to spend too much time on this, but happy to take questions if folks are really keen to understand it a little bit more. So basically what I mean by system outreach and collaboration is how are we working with or engaging with care providers, so hospitals, Ontario health teams, long-term care providers, system leaders. We work across local, provincial, and in some cases national work as well. So right now our senior leadership team, or most of them, are at a national caregiving conference in Ottawa. We have a resource center on our website. There's lots of learning opportunities for these providers to really understand the importance of caregivers, how to engage with them, how to work with them. So those e-learning modules that we have for caregivers, we have a whole bunch for healthcare providers as well, and so on. One of the things that we're working on right now within the healthcare space is essential care presence policy building. So we have a whole department called the Essential Caregiver Support Hub. And we're working specifically with hospitals and long-term care to really build out those policies and those implement those strategies to engaging caregivers as part of the care team. Another thing that we do from a system outreach and collaboration side is the other side of employment. So I shared a little bit about how we provide caregivers with education through presentations, toolkits, and resources about how to communicate with their employers, but it's a two-way street, right? So we also want to be working with employers on how can we build out best practices and how are we supporting and identifying caregivers in spaces. We work with for-profit, nonprofit, private sector, all different types of groups, small business, large corporations, and provide them with tools and strategies and training on how can you really support your employees who are caregiving and what kinds of best practices are out there that's going to make your workplace a better place for caregivers to be. And then lastly, to round out our circle of circles, we do a lot of public awareness. So 1 in 4 caregivers don't know what they need. And so it's important that they know that something is available to them, but also important that they can identify themselves as caregivers, as I mentioned earlier. So we do a number of different initiatives. We attend a lot of events and talk to a lot of people to try to help build the awareness about caregiving in general. And then, of course, what we do at OCO. So we have postcards like what's on the screen here that we send out that folks can hand out and share with caregivers in the work that they do. But we also do, right now, we're working on this campaign called the Undercover Kindness Campaign. And I'm going to show a video of what that is. And for anyone calling in, you'll be able to hopefully hear it and envision what the video looks like, or go on our YouTube channel and find this. So this is one of what will be 4 videos that we've done. Again, Undercover Kindness Project. And essentially what we're trying to achieve with this is bringing awareness to the role of caregivers, how important they are and the types of things they do, but also that sometimes a really small act of kindness can make a huge difference for folks. So before I share the video, I just want to clarify, this is not a program that we offer. We don't go out and do these things in people's individual homes, but it's here to let the general public and anyone really know that sometimes just a small act of kindness can make a really big difference in a caregiver's life.
Hi, I'm Erica.
And I'm Vanessa, and this is my mother's house. She has been looking after my grandmother for so many years, so she actually thinks that she's helping her grandson with a school project today. But we're gonna surprise her with an act of undercover kindness.
Hi.
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 Remember how I told you you were helping Lucas with a project?
She lied.
I lied. So we're actually here to fix up the greenhouse.
We decided to do this for you because you do for everybody else.
Oh, my gosh. So much. Yeah.
You deserve it.
This greenhouse has been here 40 plus years. My dad built it. She starts all her seedlings here. If you could see this in the spring, summer, it's amazing. If you look over there, there's a little sign that says John's Greenhouse. It's my dad. It's been standing here a long time.
If we fix this step for you and make this a little safer, do you get some free time?
Oh, I think I will. Yeah, that would be amazing.
So my mom, she's incredible. My grandmother's 94, and she's the sole caregiver for her. She buys her groceries. They do everything together. Takes her for her hair appointments, doctor's appointments, all of that. She doesn't expect anything back. She just does it.
How is this a gift to your mom, the caregiver?
It's a safe place. It's somewhere where my grandmother can be and my mom can have a little break and not have that worry that, oh my goodness, is she gonna fall in the step? Is she gonna be able to get in herself? So that's how it helps my mom.
You all live on the same street.
I moved into this house and my grandmother moved out. And then 5 years later, it went up for sale. Well, my mom bought it back. And now my grandmother's back in the house with my mom, living basically in her house again.
That is like a fairy tale.
It is for everybody. We love it.
So tell me the story about why you submitted.
Our family has had a really hard year. If it can just give them a little bit of happiness. They both do so much. They could use a break.
Oh, we are going to light her up. And I was wondering if you had any advice for people who have a caregiver in their life.
People always say, call me if you need anything. Like, I'm here if you need anything. So what I would say is they are never gonna call you to ask you to do something. So rather than just offering it, just do it. I've got surprise for you. And the lights, and they painted everything.
Oh my God. Yeah. Float around in the pinhole sky. Watching the diamonds blink I know. So hold on, only you.
Hi, I'm
So that's a sample of, like I say, that Undercover Kindness campaign. There's been a few other videos shared with different stories and different acts of kindness. So if that's something that you're interested in seeing more of, again, you can go on our website or our YouTube channel to learn more. And that's it for me so far today. This is my name and my email address and how you can find me. I would encourage you, if you're interested in staying up to date on the things that we're doing at OCO, that you subscribe to our newsletter, check out our website, follow all those things on social media, whatever method works for you. And we have lots of time for questions now. So I'm going to go ahead and stop sharing my screen and we will take some time for questions.